Hello everyone, welcome back to my channel. Today we are going to talk about a very important health issue, cervical cancer. This video will help you understand what cervical cancer is, how to prevent it, and why it's important to get screened. What is cervical cancer? Cervical cancer is defined as a malignant tumor that occurs in the cell of the cervix, which is the lower part of the uterus that connects to the vagina. This type of cancer is most commonly caused by persistent infection with high-risk type of human papillomavirus. It typically develops slowly over time, starting with precancerous changes in the cervix that can be detected through screening tests before developing into invasive cancer. Causes and risk factors of cervical cancer. Number 1. Human papillomavirus infection. Most cervical cancer cases are linked to HPV, a sexually transmitted infection. High-risk types such as HPV 16 and HPV 18 are responsible for the majority of the cases. Number 2. Smoking. Tobacco smoke contains carcinogens that affect the cervical cells, increasing the risk of cervical cancer, especially in women infected with HPV. Number 3. Weakened immune system. Conditions that weaken the immune system such as HIV/AIDS or immunosuppressive drugs can reduce the body ability to fight HPV infections, leading to an increased risk of cervical cancer. Number 4. Long-term use of oral contraceptives. Prolonged use of birth control pills may slightly increase the risk of cervical cancer, especially if used for 5 or more years. Number 5. Multiple full-term pregnancies. Women who have had 3 or more full-term pregnancies may have a higher risk of developing cervical cancer. Number 6. Early sexual activity and multiple sexual partner. Engaging in sexual activity at a young age and having multiple sexual partners can increase the risk of HPV infection, thus alleviating the risk of cervical cancer. Number 7. Family history. A family history of cervical cancer can suggest a genetic predisposition to the disease, increasing an individual risk. Number 8. Family history and lifestyle. Poor diet, lack of physical activity, and obesity may contribute to the risk of cervical cancer. Understanding these causes and risk factors is essential for prevention and early detection strategies, including HPV vaccination and regular cervical screening tests. Cervical cancer often does not show symptoms in its early stage, which is why regular screening is crucial. When symptoms do occur, they may include: Number 1. Abnormal vaginal bleeding. This can include bleeding between periods, after intercourse, or postmenopausal bleeding. Number 2. Unusual vaginal discharge. This might be watery, pink, or foul smelling. Number 3. Pelvic pain. Pain during intercourse or at other times. Number 4. Pain during urination. This can indicate that the cancer has spread to nearby tissues. Number 5. Heavier and longer menstrual period. An increase in the volume or duration of menstrual bleeding. Number 6. Swelling of the legs. Number 7. Weight loss. Number 8. Lower back pain. Regular Pap Smear and HPV testing are essential for early detection and prevention. If you experience any of these symptoms, it's important to consult a healthcare professional promptly. Prevention. HPV vaccination. One of the best ways to prevent cervical cancer is to get HPV vaccine. This vaccine can protect against the type of HPV that most often cause cervical cancer. It's recommended for boys and girls starting at age 11 or 12 but can be given as early as age 9 and up to age 45. Thanks for watching. If you enjoyed this video, be sure to give it a thumb up and subscribe to our channel for more content like this. Don't forget to hit the notification bell so you never miss an upload. And if you have any question or suggestion for future video, feel free to leave them in the comment below. Until next time, take care and stay tuned for more exciting content.